Hello guys, welcome to another video. So a bit of a change of scenery for me. I'm in the lovely Suffolk, different area of England, so I'm here visiting my parents, and it's kind of a lovely relaxing place to be. So it's a perfect place to be to sort of recover from surgery, and that's what I wanted to talk about in this video, is how has my recovery from my surgery been going. So it's been 2 weeks exactly today since I had my surgery to remove my neuroendocrine tumour and the lymph node, and yeah, generally things have been going pretty well. Definitely getting better. Unfortunately, it's not been that kind of linear improvement that I would love to have had. It's definitely been more kind of up and down, but we're trending upwards. So yeah, things to be positive about, definitely. One of the things that is definitely improving every day though is kind of the wound. So that's looking nice and clean and tidy. And you know, initially it was very sore and it was struggled to move around, and even sort of going from lying to sitting was difficult. You know, I'd sit up and I'd feel like my whole insides were kind of shifting, and it's quite painful. But now I can move around pretty freely, to be honest. I even tried doing a few press-ups the other day, which was probably a mistake. That'll do for now. But oh well. But yeah, so that side of things, pretty good. So the issues I've had are more kind of those internal digestive related type pains, which are kind of no surprise considering, you know, I've lost 15 centimetres of my small intestine. I actually had to go and see a doctor about some pains I was getting, and I did touch on the fact that I was experiencing pains in my last video, but we basically came to the conclusion that it's probably cramping of the pelvic floor muscles and muscles low down in my digestive tract, and I'll leave that to your imagination. But yeah, it had me kind of doubled over in pain. It was horrible. Thankfully, the intensity of those pains has definitely decreased, and I don't get them all the time. Like, I'm, you know, pretty much pain free down there at the moment, which is great. They do come and go a little bit still. Take last night, for example. I was lying in bed, unable to sleep because of some pain. It wasn't too intense or anything, but it was just enough to keep me awake, which was a bit annoying. But contributing factor to that probably is I am a little bit constipated at the moment, which is something new to me. And again, no real surprise. I was on some quite strong painkillers in the hospital, which can block you up, obviously. I'm no longer on those. I came off those as quickly as I could, really, and I just been taking paracetamol as and when required, really. Obviously, I've had a bit of a change of diet as well. That's going to be contributing to the constipation. I'm moving around less, which isn't going to be helping. So yeah, it's no real surprise. Lanreotide, the four weekly injection that I take for neuroendocrine cancer, can also mess things up with regards to that. So unfortunately, I have had to resort to taking a laxative, which I really wanted to avoid, to be honest, because I don't want to get reliant on stuff like that.
1/2 teaspoon for fast, effective relief.
So I will look to reduce that as as quickly as I can. But yeah, needs must at the moment, and it does seem to be helping things with regards to pain and stuff. So yeah, I'll continue to take it for a while. But yeah, just touching on the food side of things. So luckily I've moved on from yogurt and jelly, my yogurt and jelly diet, or my yelly diet. And yeah, I've been eating things like soups, and my diet's actually been returning to almost normal now. It's not far off, you know, still a little bit careful with things that I'm eating. I've been having some potato, some fish, little bits of veg here or there. Thing I have got to be careful with is the amount that I'm eating, so don't want to overload the system too quickly. So yeah, just trying to keep my portion sizes at a normal level, even though I've been pretty much hungry since I left hospital, and I really want to put on a little bit of weight, because I've lost weight since the beginning of this whole thing, and I really want to put on a little bit of weight just to help with future treatments and my next operation, if and when that happens, really. But one of the things that's been bothering me the most probably is shoulder pain, and it's been the thing that's been stopping me being more active, I suppose, stopping me going for a walk. So the longest walk that I've managed so far is probably about half a mile, which for me is really irritating. And the reason being is because the pain in my shoulders just stops me going any further. So I've got this intense ache in my shoulders when I move around, particularly in my right shoulder. And it's a pain that I had very soon after the operation. And when you have laparoscopic, so keyhole surgery, you get pumped full of air, and obviously that air has to escape, and often it goes upwards and can cause some irritation. In fact, on my ward, it was a common complaint from the patients to the nurses that they were in a lot of pain in their shoulders, because this is the pain that you just can't get comfortable with. And that's continued for me 2 weeks on. And I wanted to ask your advice, actually, if there's anyone to help me in the comments that's had laparoscopic surgery or knows anyone that's had laparoscopic surgery, how long they experienced this shoulder pain for, because to me I feel like that pain should have gone away by now. But yeah, it'd be nice to know if anyone did feel that pain 2 weeks on. That would comfort me in some way. I mean, it could be that it's just caused by something else, but yeah, you can get referred pain from your abdomen to your shoulders, so it could just be the inflammation in my abdomen that's causing this pain. And obviously they did a fair bit of poking about, looking at my liver and things. They might have just irritated something that's left me with this dull ache in my shoulders. I think it's important that I try and move around as much as I can. If it is still trapped air, that's going to help move that on. But yeah, so that's the thing that's bothering me the most. But hopefully in a week's time, that'll be a distant memory, and we'll just continue to improve and get better, and I can get more active and be ready to get on with the next stage of this whole thing. And what is the next step or the next stage? So I've got a consultation next week with my surgeon, and yeah, I don't know how much information I'm going to get from that consultation, whether he's just literally going to be seeing how I am, or whether he's going to have some good information for me as to what's going to be happening in the next few weeks. I do hope that he has a bit of info with regards to the fact that my tumours gone off to the lab and they've looked at it underneath the microscope, which is going to give us a bit of a better idea of how quickly my cancer is growing, which will then determine what treatments will be effective if needs be in the future. It'd be quite comforting to know that I have got a slow growing form of neuroendocrine cancer, so hopefully get some good news about that. But it's not going to be until the 2nd of June that I actually speak with my oncologist, who's obviously leading my treatment. So I think it's probably going to be a case of waiting until then till I know exactly my next steps. So I'm just going to concentrate on my recovery in these next sort of 3 weeks or so, get back to full strength, as close to full strength as I can, and then I'm going to be ready to just tackle the next step of it. And I've obviously got a big surgery still to do, hopefully, as long as we can stick to the plan and nothing scuppers that. So that's my update really, guys. Things are going pretty well, feeling pretty positive, and if I think back to 2 weeks ago, I've come a pretty long way. So yeah, feeling pretty happy. Lovely to be here in Suffolk and to see the family, so nice. And thank you again for all your support. I hope you're all well. Your comments honestly blow me away, your support blows me away every day, so thank you once again for all your support, and I'll catch you in another video.